Hey everyone, hope you guys can hear me okay. Welcome to the webinar today. And as Celeste says, our topic today is all about pregnancy and the skin. Now I know during, for those of you who are tuning in, again, like Celeste said, that we'll just be keeping our cameras and our audio on mute, and Celeste will be managing that chat room for you and getting people entered in as they log on. If you for those tuning in maybe a little bit later, if you tune in later today or somehow missed the beginning of it, I just want to let you know we are recording it, as Celeste just said, so we'll be able to have this for you, so just in case something comes up that way. So again, my name is Beth Bialko. I'm just with the global team with Dermalogica and the International Dermal Institute. And this is a topic that I hear questions about all the time when it's coming from a lot of our therapists, our professional skin therapists out there, which is, can I use this? Can I not use this? What happens during the skin? I'm kind of nervous about treating a client who is expecting. I'm not sure, what I should be doing or what advice can I give? So this course today is just really about giving you more information, giving you more empowerment, I guess you could say, when it comes to understanding your client who is expecting and what she could be going through, what we can help her with when it comes to questions. So as we know, the body goes through many changes when it comes to pregnancy. Now it's going to vary for every a little bit differently, to vary as far as
because it was blocking me. I just now when you did that, it worked.
What they know. So one of the things that we do know for sure is that 90% of pregnant women will have some sort of skin change. So today in our topic, we're going to be looking at things such as hormone-induced changes, pregnancy-specific issues or concerns on the skin that might pop up. Then we're also going to be talking about ingredients. I know that's a big question when it comes to what can I, as a woman who is expecting, what can she use or what can she not use? And there's some areas, I'll be honest with you, that are a little bit gray. One of the things I like to express, though, is we are not doctors, right? We're not their OBGYN, their general physician. So we don't want to be diagnosing or actually, going in and saying like, oh, this is okay if we're not sure. If in doubt, I highly recommend that you have your client check with her physician, because even if it's a safe ingredient, if she's still not comfortable with it, what we want to do is be sure that we're respecting those wishes and we're having an open conversation. So everything we're following through today is not an exhaustive list. I mean, the industry and these things are changing constantly, but we do want to at least give you some more information so that you feel a little bit more comfortable when it comes to these questions as well. So as we head in today, one of the things you might be thinking of is, well, maybe what if I don't have any clients who are pregnant? But it's interesting is that the statistics are kind of showing the fact that in the United States, over 3.7 million births happened just in 2018. And the general fertility rate for women was about 59 births per 1,000 women. So what does this mean to you as a skin therapist? Well, honestly, this means that there are very high chances that you're going to be treating a pregnant client or potentially someone who is also expecting or trying to become pregnant. So what we're going to do is let's review some of the topics for today, just so you have a general outline of what we're going to be covering. Okay, so first we're looking at hormones and the skin. So these are going to be your body's chemical messengers that are going to be released from the endocrine glands. So they work slowly and over time, they affect different processes. So today, what we want to think about are more of our sex or steroid hormones. So we're going to be thinking about like androgens, estrogens, progesterone, etc. So with the possible exception of puberty, pregnancy is actually a time that the skin is rapidly affected by these hormones. We're going to take a look at the three categories of changes. This is hormone related due to pregnancy, pre-existing skin conditions, because some of our clients may actually have conditions such as like acne or rosacea pre-existing, and pregnancy-specific conditions. So we're going to actually dive into these a little bit further today and take a look at the skin's structure and some of those conditions like melasma, stretch marks, acne, and even some maybe skin issues that might appear for your client that she could have questions about that we'd want to refer her to a doctor. Then we're going to be headed into taking a look at skincare ingredients. So there's a various amount of ingredients. We're going to take a look at what are safe, what are considered safe for the client, and then what are actually considered a no-no. And then treatments and tips. This is super important. We need to stay educated. So we're going to give some examples of what you could do in the treatment room and just little mindful moments that you want to think about changing up in your treatment for that pregnant client. So let's take a look at hormones first. I like to just give like a backstory of how that actually works in the skin. So we'll have a video here for you to play. So the main players with ovulation are the pituitary gland, the ovaries, and the uterus. So they're closely coordinated. And each month, the female cycle begins actually in the brain with the pituitary gland. And it works alongside of the ovaries and the uterus to bring about an egg getting released from the follicle. So the pituitary gland is under control by the hypothalamus, and a new cycle begins whenever the cells of this center secrete what's known as GnRH. So the hypothalamus is going to secrete what's known as gonadotrophin releasing hormone into the blood vessels kind of surrounding that pituitary gland. Now, stimulated by the pulses of GnRH, the cells in the pituitary gland actually initiate a release of another hormone, and that's called your follicle stimulating hormone. And with this, it travels through the bloodstream and it reaches the ovaries and starts to stimulate the ovarian follicle. So the follicle contains the egg, and that's surrounded by cells that secrete estrogen and other fluids. And FSH actually helps prepare the egg to mature and get ready for release. Now, as the hypothalamus increases GnRH and the pituitary gland continues to secrete FSH, what we're noting is another key hormone is going to be secreted by the pituitary gland, and that's called your luteinizing hormone, or LH. Now, LH will actually peak at ovulation, and the follicle will then burst and the egg gets released. And it's going to, of course, be traveling down through the fallopian tube on its way to be fertilized. Now, it takes around about 5 to 6 days to reach the uterus. And what's interesting is that the ruptured follicle that's left behind actually becomes a yellow body, or also known as the corpus luteum. Now, the cells of corpus luteum actually are known to produce progesterone, and this is preparing the body for fertilization. And then, of course, the uterine lining is going to start to increase. Now, during the first half of the follicular phase, we're going to see an increase in a hormone, and we're also going to see an increase specifically in estrogen after ovulation. And then we'll see a little bit more of a surge in progesterone, which is actually secreted by the corpus luteum. Remember, that's that yellow body that was left over after the egg was released. So during the first half of the phase, again, we see that estrogen, second half more towards that progesterone. Then if no pregnancy occurs, what happens is that the levels begin to decline, the corpus luteum can wither, and the body simply sheds the lining. So that happens, of course, in a natural menstrual cycle when there's no when pregnancy does not occur. Now, if pregnancy does occur, if the egg is fertilized, the corpus luteum continues to secrete progesterone over the first 3 months of pregnancy, and numerous changes start to happen to develop the embryo. such as a temporary endocrine organ known as the placenta. So this gives us just a whole idea of how many changes are really happening with the body that, we're not under control of. But what we do want to know is what happens to the skin when these hormonal induced changes start to occur. So just as a quick recap, we have our hormones. So the follicle stimulating hormone and the luteinizing hormone, both of those secreted by the pituitary gland. One, of course, FSH, stimulates the growth of the ovum containing follicles in the ovary, and the other one is going to trigger ovulation. And it also, as remember from the video, that corpus luteum is actually going to trigger more progesterone. So how does this actually affect the skin and the hormones? Well, two big players here and are regulators during pregnancy is estrogens and progesterone. And they, of course, are going to tend to rise. So estrogens is basically the umbrella name for the estrogens underneath that. So that's estradiol that you're going to see listed there. And that is the most abundant form in adult females. Estrone is primarily going to be present during menopause. And estriol is the primary estrogen during pregnancy. When we're looking at the estrogen that's being produced, is that they're responsible for a lot of changes, not only sexual development, but the growth of female characteristics, and it's included in ovulation. Progesterone is going to prepare the uterus for fertilization and helps to maintain that pregnancy. Now, in the first trimester is when the level of progesterone tends to be at its highest. And it's interesting because this tends to be when most women are experiencing acne in pregnancy. It tends to be gets worse. So one of the things about the progesterone is that it has a little bit more of an androgenic type of activity to it. And it can stimulate and give higher levels or higher rises to secretions of the oil glands in the skin. So the skin can actually become a little bit oilier, more sebum production, some congestion can start happening. And this is oftentimes very prevalent in the first trimester, and it's because of this hormone, progesterone. Now, what happens also too, it's interesting when it comes to other skin changes, is the estrogens and the progesterone will actually in combination kind of work with what's known as alpha melanocyte stimulating hormone. So these three hormones in combination are going to kick up the output of melanin by the melanocytes. And that's where we see that darker pigmentation and also to the melasma. The other thing that happens when these hormones are high and highly active and at higher levels is it can increase sensitivity to the skin. So this just gives us a little bit of a background of what's happening with these hormones and why the skin might become really oily or aggravated or sensitized in that first trimester, because we have progesterone and estrogen that are combination. And then of course they act upon with the alpha melanocyte stimulating hormone. And then we see things like melanogenesis. We also need to consider the other endocrine organ that I mentioned, and that is the placenta. So after the conception, the egg actually implants itself into the uterine lining, and this hormone called the human chorionic gonadotrophin, listed here for you on this slide, it's going to basically be produced, and it has a very predictable rise in the early weeks of pregnancy. Now, one of the things that HCG is thought to support the pregnancy by is ensuring the ovarian production of progesterone. So it's produced by the cells of the placenta, and it stimulates that corpus luteum, right, that yellow body, to keep producing progesterone and estrogen. Now it's going to start to decrease around second trimester, because what it's doing is it will stay active until the placenta is ready to take over. So once the placenta is developed, it then kind of takes over that responsibility, and it begins to control progesterone and estrogen. So, studies have showed, though, what's really interesting here is that studies have showed that the placenta can, which is really rich in what are called bioactive sphingolipids, can actually induce melanogenesis. And it does this because it upregulates various enzymes like tyrosinase. And as we know, that when there's an increase in tyrosinase, we're going to see an increase in melanogenesis. So really interesting studies that are out about this. I wanted just to kind of bring that up to you because it makes sense then why a lot of women after they've had the baby may start to see their melanogenesis starting to basically lessen. Okay, so it gives us a little bit more about kind of what's happening with his hormones. So what are some of the hormonal situations that are happening that we see when it comes to changes on the skin? So we're going to see through here pigmentation, vascular changes, glands, and connective tissue. So pigmentation, we're going to be talking about melasma or chloasma, oftentimes referred to as a mask of pregnancy. And of course, that can be a pattern across the cheeks, across the chin, the forehead. Sometimes we know that pregnant women, it can lighten after pregnancy, but for some women, it doesn't change and then actually can remain for quite a few months up to a few years. We're going to see vascular changes. So with increased blood flow in the body and blood abundance in the body due to pregnancy, there are some changes that we're going to notice, such as flushing, rosacea can be exacerbated. We may also start to see things like spider nevi and telangiectasia. The glands are going to be like your sebaceous glands and your sweat glands. So during pregnancy, a woman can notice that she's producing more oil on her skin or she's perspiring more. So I know as on top of pregnancy, you know, having more oil or acne and perspiring more is not necessarily what every woman wants, but it does happen due to hormones. And the connective tissue. So think of stretch marks. So we start to see a weakening in those elastin fibers and collagen depletion when these hormone changes start to happen. So when we head over into our next slide, let's first start talking about pigmentation. And there's our two forms. I want to talk about the face, and then I also want to share with you some information what can happen on the body as well. So when it comes to pigmentation, some women will experience a degree during pregnancy, and it can continue after. So the mask of pregnancy, which is also again referred to as melasma, this can be considered one of the most common skin conditions. About 70% of women will experience pigmentation or melasma in the first and second trimester. This is definitely known by these brown patches that can be seen anywhere on the face, forehead, your cheeks, the nose, and chin. So remember back to talking about these hormones, that combination of estrogen, progesterone, and the melanocyte stimulating hormone can cause a lot of this discoloration. So again, there are other things that can cause melasma. Some people, when they are on birth control, that can actually be affected, but we're really focusing strictly here what happens with pregnancy today. Now, it can go away for some women, it can fade, but some may need to have treatment. But what we can do is, while our clients are pregnant, is finding things that they can use to help protect their skin. And of course, first and foremost, a physical sunscreen is going to be super important. The other type of pigmentation that can happen is called linea nigra, and this is going to be a line across the belly. It's a picture of it right there for you. Now, many women normally will have a very faint white line called linea alba, which is barely visible. And then what happens is when they become pregnant, that line becomes darker. And it can extend upwards from the navel, around the belly button, can go down to the pubic bone, and it usually disappears in a few months after delivery. A lot of women get concerned with that, and they might be looking about treatment for it. But again, a lot of treatments such as like retinoids that need to be avoided during pregnancy, that would be something they could discuss with their dermatologist after pregnancy and after breastfeeding. Other areas to be aware of, pay attention when during your skin analysis, during like any type of like moles or freckles that may have become bigger or more pronounced. If you notice some changes of those during their pregnancy, refer them to their doctor if you suspect something is going to be a little bit different. So when we think about what could we use for pigmentation, what is considered safe? Vitamin C is highly recommended. Again, melasma can't be prevented, but its intensity can be minimized. So we're looking at vitamin C to help for brightening, sunscreen, really recommending a physical sunscreen, titanium dioxide, zinc oxide, to help keep that heat off the skin. We don't want to induce any type of heat or inflammation. Serums with oligopeptides 34 and 51 are excellent at really kind of inhibiting tyrosinase, niacinamide, licorice, amazing brightening ingredients. And lactic acid for exfoliation is also a great brightener for the skin, and it's safe in lower doses during pregnancy. Enzymes can also help exfoliate those pigmented skin cells off. So we think about papain and bromelain from when we're looking at papaya or from pineapple. Azelaic acid is a very common ingredient that tends to be prescribed or used during pregnancy for pigmentation. But again, as with International Dermal Institute, we recommend on that the client should refer to her physician to make sure, is this okay to use? Is it safe? There's going to be different percentages. Some dermatologists may prescribe it, and that's fine. That's exactly, as a doctor, they have that ability to do that. So just being aware of what they're on from, when you're doing your consultation, so that you know what your client is using at home as well. So we've talked a little bit about some of those darkening pigmentation changes. Let's talk a little bit about our vascular changes. And this are going to be three things. We notice not only a change in flushing, but this is going to be things such as like that pregnancy glow, which isn't a myth. It actually does occur. There are some other changes that maybe our pregnant clients may not be necessarily happy about, like spider nevi or those little dilated capillaries that tend to appear. And we'll talk a little bit about palmar erythema. So the pregnancy glow is definitely because of increased circulation. If you think about blood volume as a pregnant woman, it increases about 50% in the body on average. So it makes sense that there's going to be a lot of increased circulation. The cheeks can be flushing. We notice it because the blood vessels are really beneath that skin surface. And we can also see an increase of secretion. So oiliness to the skin, we might see a little sheen or shine or a dewy glow. There's really nothing for us to do here except to help them do a really good, healthy skincare routine and to alleviate any type of extra sensitivity or flushing or irritation, and also help to control some of that excess oil. And we'll go over some of these ingredients in just a moment. Spider nevi right there in the middle. Blood vessels are dilate. There's extra blood pressure right now on these tiny, tiny capillaries. This can occur in the first and second trimester. And with this, it can appear primarily in the face. Some clients might see it on their neck or their chest or the arms. So some of them will disappear. Others might remain after pregnancy. This can be treated with a laser, but it would need to be done after the mother has given birth. Now, palmar erythema, this is a little bit more of a rarity. I did want to bring it into our conversation today. It's important to know this because it could come up in your treatment room. You may get questions from a client saying, I don't know why my hands are just constantly red. So it's a rare, condition or a situation that happens during pregnancy due to vascular changes. It's more of a warm and reddening on the palm of the hands, and it can resolve pretty easily after pregnancy. But if a client would show this to you, you definitely would want to refer them for sure to their doctor. So those are some of our vascular changes that we might see that happen onto the skin. When it comes to glands and tissue changes, this is where we're looking at sebaceous glands, sweat glands, and of course, stretch marks. So hormonal activity during pregnancy, because there is an increase in progesterone, there's a noticeable change in oil and sweat. Now, one of the things that can happen here is that when it comes to acne, for some women during pregnancy, they don't experience it. Some others may. So it all kind of depends. There's a higher chance of acne being a little bit more aggravated if there is a pre-existing condition. So too much sebum, the follicles can become blocked, resulting in acneic lesions. Some women also have claimed that their acne cleared during pregnancy. That's not unheard of. But what happens especially is that progesterone, right, your testosterone, this is going to have that surge, right, from that luteinizing hormone. So they may experience that initial hormonal breakout with pregnancy. So when we see this increase in these levels, it can actually spike again between the first and then spike again at the third trimester. And we see a little bit more of oil and breakout. And we'll talk about some topical ingredients that we can do for this. Connective tissues, there's stretch marks. So this actually can occur in about 90% of pregnancies to some degree. Some women can get it on the belly, the breast, the thighs, depending on what area is stretching. But they begin really deep within the skin. And because of hormonal changes, right, this increase in estrogen, the estrogen is actually going to kind of cause like the elastic fibers to basically start to weaken. And we see collagen levels start to drop. We see disconnection and kind of cross-linking that's happening. And then we just see basically these elastic fibers are becoming rather weak. The result is purple reddish marks. Although harmless, they can be really bothersome to clients. And it's just, letting them know that it can happen. And though we can't prevent it from happening, there are some things that we can do to help kind of maintain. And we'll take a look at those ingredients next. So let's break this out between two different things: breakouts in oily skin, and then let's address the stretch marks. So when it comes to the two of these types of ingredients that we have here, first and foremost, we're going to start with breakouts in oily skin. So niacinamide is going to be safe. Prebiotics are also a great option here because they can start to help kind of balance out that skin microbiome, really bringing in more of the good bacteria and kind of controlling some of that bad bacteria that can contribute to acneic breakouts. Charcoal can be also used like in a mask or a cleanser. Clays. Clays are fantastic for helping to absorb a lot of that oily skin. Bentonite, kaolin are great examples, and glycolic acid is often used in a small amount. What you're not seeing here, of course, is we're not going to be recommending any type of retinoid or retinol activity, and we'll talk about those ingredients to avoid here in just a moment. When it comes to stretch marks, even though we don't have control of whether a client would or would not get that, there's a way to stop them from occurring. You can actually hydrate, and moisturize the skin. It's super important. So reaching for ingredients like vitamin E, moisturizers, body moisturizers really rich in cocoa butter, essential fatty acids, hyaluronic acid. Keeping the skin hydrated and moisturized kind of lessens the appearance of like dryness and lessens the appearance of the stretch marks slightly, and helps kind of reduce the stretching into the skin, making it a little bit softer and a little bit more supple. There's no substantial medical evidence that these treatments are in any way 100% effective for stretch marks, but keep in mind that a moisturized, hydrated skin definitely has better flexibility than a skin. So we're back again here talking a little bit about some of our pre-existing conditions. So if you're tuning in, hopefully everything is coming clear for you okay. So we're going to head into talking about some of the irritation and redness at this time. So Celeste, I will jump in with you before we talk about sensitivity, irritation, and some of these common skin conditions to see if there's any questions that you need me to address right now.
Perfect. We do have a couple of questions in respect to some ingredients and that type of thing. Somebody asked, would lemon be harmful for a pregnant woman?
It's for lemon topically applied?
Yes.
So citrus isn't necessarily going to be harmful. What you have to be aware of is that putting something that's like a direct lemon extract on the skin can also sensitize the skin. And also can make it uncomfortable, especially if they're going out into the sun. If you're looking at ingredients that have like a citrus base to them, like a lemon extract, lemon peel, orange peel, that type of thing, as long as like in a moisturizer or something that's more for like an evening treatment, is going to be considered safe. But when it comes to at-home concoctions, I always err on the side of caution that they need to speak with their doctor with that, because it also can depend on how their skin is reacting, if it tends to be a little bit more flamed or irritated.
Perfect. And then some people were very surprised about the glycolic portion. So we had a great question as to what percentage of glycolic acid can actually be used.
Yeah, so you want to think, so the reason, we think about glycolic is because there's no studies that are going to show any type of harm or, thing that can happen to the unborn child. There are a lot of dermatologists and a lot of doctors who will prescribe a very like low dose, like glycolic wash when it comes to acne or breakouts or oily skin. You want to think that a percentage needs to be on the lower spectrum. So we're not going to recommend a 30% glycolic peel. Like that would be a no-no. You don't want to do anything that's going to be high levels of active exfoliants, because that can actually irritate the skin. Again, I like to bring these pieces of information to you because, you don't want to be surprised if a client comes in and says, I'm using a glycolic skin wash and, it's at, 0.05%, just to help with resurfacing. Those, and again, it's not listed as a no-no, like for example, high levels of salicylic acid. So it's kind of like an alternative. I tend to recommend lactic acid over glycolic, because glycolic, if someone's a little bit more sensitive or sensitized, it can actually irritate the skin a little bit more because of its molecular size. It penetrates rather quickly. So those are just some examples just to kind of be aware of some options of what the client could use.
Perfect. Just a couple of more before we let you move on. There are a couple of questions of, we do know this is an International Dermal Institute presentation, but what dermalogica products would we recommend then for acne? Like clearing skin wash, would that be okay? Kind of that segment.
Yeah, exactly. So when you think about acne, obviously are things that are more clay-based for cleansers. We've got our new active clay cleanser, which is amazing. You want to think about things that have a low level of active ingredients. So for example, the clearing skin wash, because that is a wash off, that's not a leave on, and it's very, very minimal amounts of active ingredients in that. When it comes to treating acne, that would be considered safe.
Perfect. And then is retinol palmitate okay? Because it's more of a mild form of a retinol.
So we say, we put that as a no-no. So when you're looking at any types of derivatives of vitamin A or retinol should be avoided. Mm-hmm. If there is a product that your client's using and she's like, oh, well, I'm using this as a hydrating mask and it says it has retinol palmitate in it, they can always take that product to their doctor and have a conversation about it. But, from our standpoint as skin therapists, is just kind of currently just trying to follow along the guidelines that are recommended by, the medical community when it comes to retinoids or derivatives of retinol.
Perfect. And then this is kind of an all-encompassing. Does this information actually apply to a lactating woman as well then?
Yes. So this can go across until your client is finished with breastfeeding.
Mm-hmm.
So that's where you want, there's two different things there. So someone could be lactating, but not necessarily breastfeeding. So it may sound like an awkward conversation to have, but you do want to have that. So if they are going to continue to breastfeed, these are some of the things that you just want to continue to practice until your client is done breastfeeding.
Perfect. Awesome. There's a couple more questions, but I think they're going to be answered in the next couple of slides. So I'm going to let you move forward and then we'll ask some more questions later. Thanks so much, Beth.
Okay, awesome. Thanks, Celeste. All right, guys. So let's talk about some pre-existing conditions when it comes to irritation, like eczema, psoriasis, and rosacea. So when it comes to these pre-existing conditions, eczema or atopic dermatitis, these are going to be examples of the fact that in pregnancy, over 60% of women may experience this. Because pregnancy puts the body under kind of undue stress, that can actually kind of aggravate or trigger an eczema or atopic dermatitis breakout. Now, the verdict is still out of whether pregnancy actually itself can cause eczema, but there are some women who may experience this just due to the stress that's happening. The other thing that comes into a conversation for us to have about this is the fact that the immune system and cellular responses to that are now being switched to focus on a healthy baby, kind of leaving the mother more susceptible to eczema flare-ups. So things we want to think about is if someone is, is using a topical prescription, that should always be consulted with their primary care physician or OBGYN. What we can recommend for them to do is say, hey, you know what? Avoid irritants, fragrances, anything that could cause any type of irritation to the skin. Really hydrate your skin, rich emollients for moisturization. Cut back on your hot showers. Try not to use like a soap that could be drying to the skin. So again, some topicals are still being used that are prescribed by a doctor. But again, that's their consultation with the physician, but it's good to know to have that in our consultation cards. Psoriasis, more about like that chronic plaque psoriasis. Some women, the psoriasis can clear up during pregnancy, and some others, it can actually flare up even more. So there's not a lot for us to do other than same thing. Avoid fragrance, use, emollient body moisturizers, check in with your doctor if the condition is becoming worse, and of course, avoid scratching or breaking the skin. Rosacea can also flare up because of the increased levels of circulation in the blood volume in our pregnant clients. So in some clients, it can remain the same with their rosacea. Otherwise, it can actually become worse. So much like our previous discussion on vascular changes, that increased level of circulation, those hormonal changes, those are going to actually affect the skin. And again, there are some clients who are seeing a dermatologist that may actually have a topical prescription that is considered safe. So just, definitely I would put those notes in your consultation so that you can be aware of that. Now, what are some of the safe ingredients that we could use beyond, kind of our recommendations of a gentle routine, right? Avoid harsh scrubs, no hot showers. We want to reach for ingredients that are soothing, anti-inflammatory, calming, reduce redness, and protect the barrier. So some examples here, like our oat extract, Avena sativa, lavender, ginger, gamma linoleic acid are fantastic. Ceramides for helping to hydrate, bisabolol, red hellebig to help reduce inflammation, and physical sunscreens. Really can't stress that enough. That's just a great way for our clients to get protection, at least a minimum of an SPF 30. Higher would be ideal. but physical sunscreens with that titanium dioxide and that zinc oxide is going to be really great. Now, there are some other changes that might appear. Not necessarily is it going to affect our treatment, but your client could have a conversation with you. Discussions about their hair and nail changes. So there can be an increase in hair growth, and there can also be a decrease in the growth and production of hair during pregnancy. Some women can experience excessive hair growth, especially on the face, the body, and that's usually from endocrine changes. This usually subsides, but sometimes we want to think about cosmetic, hair removal, just being really cautious with any type of waxing during pregnancy is that if your client tends to actually get really super irritated, we want to check, maybe something like sugaring or threading might be better for them. Just think about, how is their skin right now? Am I seeing excessive signs of inflammation? Is there a lot of reddening? Is there barrier compromised? And just being really aware of how their skin's reacting when it comes to hair removal. Then there's also the fact of the skin tags. So skin tags can also happen. This is usually just excessive skin cells that cause these to grow on mom. They're more annoying than anything for the mom to be. And they're just really benign, soft, small skin growths. So if they're concerned about it, if something that bothers them, they get it during pregnancy, they can also, again, seek out recommendations and removal from their physician at a later date. So speaking of some things that can be brought up that are going to be more of a doctor diagnosed type of pregnancy specific changes, one of the most common is called pruritic urticarial papules and plaques of pregnancy, also referred to as PUP. So there's no etiology with this. We don't know where it came from, how it started. We do not treat this. So if your client shows you this kind of rash, itchiness, hiving on her belly, tends to happen in the third trimester, this is not for us to treat with something that's an over-the-counter or a retail item. We want to really have them go see their doctor to see what other type of prescriptions that might need to be applied to that. It tends to resolve on its own after delivery, but I like to bring it up just because, again, our clients tend to share quite a bit with us maybe before they actually go and see their doctor. The other two specific changes that might come up, like on the backs of the arms, pruritic folliculitis or prurigo of pregnancy. So these are just a little bit of a variant of PUP that we just talked about. It's a little bit more follicular, kind of the papules tend to kind of come up right around the hair follicle. And the prurigo is a little bit more unusual, it's a little bit more rare, but we want to make sure that they're not scratching, itching, digging, or picking at the skin, because that can cause discoloration and irritation. So if they're unsure of this, and they've never had it before, they've never had a case of keratosis pilaris, this is something, again, this is a doctor diagnosed pregnancy specific change that we'd want them to go see their physician about. So let's move in to kind of headed into the last bit of our conversation today. And this is all about, now that we've kind of taken a look at some of the changes, some safe ingredients, there are some skincare ingredients that can come up and questions for you as well. So pregnancy is an exciting time. It comes with its own challenges and concerns with skincare. Now, there are some gray areas. There are some varying opinions when it comes to doctors and dermatologists. We can't comment on all of the ingredients today, but I've kind of listed out some of the most, I'd say, frequently asked when it comes to our client. So, our job is to really help take the worry out of using skincare for our pregnant clients. And again, the key thing we'd want to recommend them is when we get started with this, let's just really be safe. 3 easy, safe, and simple steps when it comes to working with our pregnant client. Number 1, recommend that they consult with their OBGYN or physician to before treatment or product use if there's questions or, concerns. Be cautious. If the client is in her first trimester or she's experienced complications with her pregnancy or previous pregnancies, we don't need to be aggressive during pregnancy for skincare treatments. We can do things that are helping with, hydration, protecting the skin, soothing the skin. And then even if you know that that ingredient is safe to use, if your client is uncomfortable with it, if she says to you, I don't want to use lactic acid in any level on my skin, no matter how small, we need to respect that. And that's going to be super important, is that you have the conversation. So again, we can't get into every single ingredient and every single question out there from our clients, but these are some of the most common. So ingredients to avoid. So number one, yes, retinoids should be avoided. These are one of the skincare ingredients an expectant mom should not be using. Even though they're fantastic for helping with breakouts and with aging and with acne and fine lines, retinoids are a type of vitamin A that, and studies have shown these high doses during pregnancy can be harmful. So we want to make sure they're avoiding, high levels of retinol, retinoids, even prescription like Retin-A, Renova are examples. Oral retinoids, isotretinoin, our client would not be taking this while she is pregnant. So again, studies are constantly being updated and changed, but for our purposes, we're going to definitely just recommend to avoid any type of, active retinol. So if you're thinking like, I've got a retinol cream I use in the evening, and your client's like, well, there's only a small amount in there, we're going to say that's a no-no. Now, if a client says to you, I didn't realize that my nighttime cream had retinol in it, I can't believe I've been using it, oh my gosh, be calm, help them, we don't want them to panic, and just recommend like, listen, you're okay, but you need to discontinue that product until you are have the baby, until you are done breastfeeding, just to be safe. Hydroquinone is also a no-no. So with hydroquinone, the thing about this is that 35 to 45% can be systemically absorbed. So it's best to avoid this during pregnancy. It's typically used for lightening and brightening, especially with like melasma. But it's, because of its substantial absorption rate, it's best to avoid this. So we can do things again like licorice, oligopeptide, niacinamide. There's always, and again, sunscreen, always ways to make sure that we can help protect the skin and with the melasma. Now, two controversial questions on ingredients are essential oils and salicylic acid. So I wanted to bring to you guys today both sides of the coin, if you will. So often essential oils are in the do not use zone with pregnancy. And it's really the caution behind this is primarily in the first and sometimes the second trimester. To be on the safe side, most doctors will recommend that we do not use essential oils for like body massage, for face massage during that first trimester. Reason being is that essential oils are attracted to the sebaceous glands, and due to the nature of the oil, could possibly, begin to enter into the bloodstream. So those are kind of the background research studies behind it. Now, there are studies out there, such as like according to the International Federation of Professional Aromatherapists, there are some instances where essential oils have been used to alleviate issues when it comes to pregnancy. And the only time that they're using that is at usually after the second trimester, and only if proper dilutions are being used. So, the safety issues to consider that someone who is an aromatherapist would consider are the quality of the oil, the chemical compound, the dilution of the blend. Undiluted oils are not to be used on the skin. So to be extra safe, it's definitely great to avoid these, And again, you may have instances where someone can say, oh, listen, I'm seeing someone who, is certified in this, and she's using, very low dilution of an oil for swelling around my calves, or for headaches, or for cramping in my lower back. So I wanted to bring this to your attention because, again, you may, have that client who says, oh, I use this and it's been totally fine. If that's the case, they're probably using something that is a very low percentage, and also in a blend. So it's going to be highly diluted in a safe carrier oil. So again, there are other options like a hydro essential, which is a water soluble fraction of these oils. These are water loving nature. They don't penetrate, into the bloodstream. This is something that can be safe to use. What are called hydro essentials. That there are some other examples. When it comes to salicylic acid, this, of course, in the majority of times is going to be a no-no. It's part of the aspirin family. This beta hydroxy acid is, great at treating, acne. You can find it in cleansers and toners and gels and creams and masks. But right now, doctors are really unsure of its, action on the skin topically. But just to be safe, they say that because salicylic acid is part of the aspirin family, it's a no-no for pregnant women because of its ability to penetrate topically into the bloodstream. So oral form obviously is definitely a no. Topical, they're going to avoid topical use of salicylic acid. But then again, you're going to also have varying opinions where we see doctors and dermatologists who say that in a small amount applied to the skin, less than 2%. And if it's considered a wash-off product, so an example, a cleanser, then that, something that's not used in large areas of the body, maybe just on the face or areas of breakout, then a doctor or dermatologist might say, hey, that's okay to use. So look for warning labels on skincare products. A lot of them might say avoid using if you're pregnant. When it comes to, whether it's a serum or a moisturizer or a cream or an active topical treatment. But just being aware of that, in the majority of the time, salicylic acid is no, but there are cases when it is below a 2% strength, considered a wash off, like a cleanser. If you have a cleanser that's a 0.5% as a wash off, don't be surprised if maybe you have a client who could possibly be using that. So these are just some of the hot spots. Definitely sometimes controversial topics, but I like to bring to you guys definitely what is happening out there in the industry, what are some of the conversations that are happening, and what to be prepared for as well. So the other thing we look at are there's going to be things that happen that you might get questions about these types of ingredients that say, hey, you know what? What's considered safe? Are these considered safe? So glycolic acid, that was a great question we had earlier that Celeste gave me. Most are going to say that this is okay. It's a great alternative to treating salicylic acid, treating acne, alternative to salicylic acid, excuse me. And majority of doctors and professionals would say that it's really of no concern to use this. Lactic acid tends to be the most popular choice. It's another alpha hydroxy acid for brightening the skin and great for treating pigmentation and safe during pregnancy. Sunscreens, I've talked about this before today, is that we really want to use sunscreens during pregnancy to especially help with melasma protection, hyperpigmentation that could be induced by excessive sun exposure. Physical tends to be the best to keep the heat off the skin. I've gotten questions about self-tanning agents. So, there's an expert response on this is definitely mixed. There's not a lot of research on DHA or self-tanning agents. A lot of experts feel that there's no significant risk to using a self-tanner sporadically. Like a lot of people just use it on their legs, or they might use a self tanner, on their arms or upper chest, like for a big event or a vacation or a wedding. So limiting it to a smaller surface area is great if someone's concerned. Obviously, that first trimester is where we need to be cautious. So maybe waiting after the first trimester to begin applying a self-tanning agent could be a great, safe way to apply that. What they do recommend, however, is to avoid those types of sprays or walk-in booths that you walk into where you stand there and you have self-tanning, agents sprayed upon you. And the reason that they recommend to avoid that kind of fake tan spray or spray tanning booth is that there's that chance of inhaling the DHA. There's no effective studies or conclusive studies linking that to any issues, but again, best to avoid that tanning, that self-spray tanning booth until after the baby is born. Now, benzoyl peroxide is another controversial kind of topic that comes up. You'll have doctors and professionals that will say as a spot treatment and or as in a wash off, like a cleanser, that it's safe in low concentrations. So they're saying safe in low concentrations being less than 5%. So it helps to really combat some of those blemishes. But again, it hasn't really posed a major concern. But then on the flip side of that, you're going to have other doctors and professionals who say, no, completely avoid this. You want to have that conversation with your client to see where they are on that. But right now, studies are showing is that it's an alternative to salicylic acid in small amounts, low concentrations with this. And if they have any questions, again, refer them to their doctor, their physician, or their dermatologist. Now, of course, vitamin C, again, just no reports that state that vitamin C is not safe. It doesn't have any type of negative effects. It's amazing for helping with brightening. It's great for post-inflammatory hyperpigmentation. It's great for aging. And that's an awesome serum or treatment that you can use for your clients. Enzymes are also safe. Think your papain, your bromelain to help really kind of loosen up those dead skin cells, kind of digest that, give it more of a smoothing, brightening effect. And just because we can't use retinols while we're expecting, peptides are going to be your pregnant client's next best friend. So we're thinking about peptides that are going to have the ability to really help with fine lines and aging, any type of helping to firm the skin, great to use all over the face, around the eyes, and also to down the neck. So niacinamide is also considered safe as well. And that's great for not only pigmentation, but it's great for aging and acne. So there's a lot of options of things that a client can definitely do as well. So as we wrap up the day, before we go into treatment, caution, and contraindications, I'll take a moment here with Celeste and see if there's any questions that we need to answer before we head into our last few minutes of the day.
Perfect. We do have some really, really great questions. Is there a certain term in the pregnancy where it's unsafe to receive any form of a treatment?
Okay, so usually most cautionary times are going to be in the first trimester. That's where it tends to, you'll definitely hear from doctors and professionals who'll say, you know what, I want you to kind of wait until after that. Honestly, if you're doing a skin treatment in the first trimester, that's more about soothing, hydrating, it doesn't have any active, aggressive ingredients, that's going to be fine. Shorter treatments would probably be best. And of course, I'm headed into the next slide here. We're going to talk about some of those cautions and contraindications that we need to be aware of.
Perfect. And then we did have a question about lavender. And is lavender a big no-no, or how do we feel?
Lavender is safe. So, and I say that in skincare. When it comes to an essential oil, that's a really kind of gray area. It's not considered a toxic essential oil, but remember with essential oils, they need to be very low percentage, very much diluted, and that needs to be done oftentimes after the second trimester. First trimester is definitely a no-no for essential oils.
Perfect. And then we've had a couple of people ask this. Mandelic acid, can that be used since it has a larger molecular weight?
Yeah, absolutely. So that's considered safe. You might even see clients say, hey, you know what? My doctor gave me kojic acid for brightening and exfoliation. You know, the big one, the big controversial one is salicylic acid, and that's a beta hydroxy.
Perfect. And then some people are asking about Dermalogica's additives, which I would say you would not use during pregnancy, but they did ask about the Calming Botanical Mixer.
Yeah, Calming Botanical Mixer is safe. That is what would be considered a hydro essential. So that is the water portion of the essential oil. So there's not going to be any type of high levels of active essential oil ingredients in that. It's going to be simply the kind of the expressed water off of that process. So you can still use that safely in, you know, mixing it into your products, into your cleansing water, adding it to your steam towels. I do like to recommend that during pregnancy, you can be slightly more sensitive to smells. So check in with your client and say, hey, does that smell good to you? Does it feel too strong? There's a lot of women where their sensory, their noses are so heightened that even the tiniest little bit of aroma might make them nauseous. So check in with that in your consultation.
Perfect. Okay, and then just one last question before you go into the next one. What about LED lights?
Yeah, so LED right now, they're between like the blue light and the red light. The ones that are going to be more prescribed for like using on like the face to help with like clearing up like acne or helping with sensitivity, those have been in most cases deemed safe. Again, it's another gray area between doctors and professionals. You'll have some doctors that say, no, absolutely not. And there's some doctors are like, absolutely, it's fine. It's not going to be harming anything. If anything, it's basically a non-product based treatment to help clear up your breakout. They may have reservations on how often the client can have that done and for how long. And of course, think small areas, right? Think the face, you know, or like the chest if there's some breakout on that. And if in doubt, again, that first trimester, I would avoid it. But after that, just again, have your client also can check in with her doctor if she's concerned.
Perfect. And then one more before we move on. There was someone that asked about sulfur. Now, is sulfur safe to use during pregnancy?
So we're looking at something that's in a spot treatment. So I guess it's also to a bit of a question back where it's like, if it is put into like a spot treatment or something to help heal and dry the skin, that's going to be considered safe because it's going to be mixed in as well. I haven't seen any conclusive studies that have linked that to be unsafe. So nothing as of yet, but as always, we're constantly looking and studying and researching. So we'll give that one another look for you too.
Perfect. Thank you so much, Beth.
Okay. All right. Awesome. Okay, you guys. So just a few things when it comes to cautions and contraindications to your treatment. So we're going to just review. These are some of the kind of top discussed areas that are a bit concerned with that as well. So when it comes to reflexology, that's oftentimes a question. There are some areas that we want to be sure that we avoid reflexology until after the first trimester. So during the first trimester, we're not going to be administering any type of reflexology. After that, a foot massage, after the first trimester, a foot massage is definitely considered safe. So you just want to really also to be sure some of your professional guidelines, like avoid like the ankle area, the Achilles, the acupoint, bladder 60, areas around the ankle bones. Those are some areas that can be contraindicated to pregnancy when performing this type of massage. Massage in general is great. I mean, that's going to help reduce anxiety and stress, muscle aches, swelling. Think about, though, with massage, it's all about making sure that your client is well supported. So we don't want them lying, completely flat. We don't want their feet higher than their head. You may be moving into more of an effleurage massage versus a deep tissue. So just definitely some cautions around massage. With heat, using heat during the treatment can be a little bit overwhelming to some of our clients. And so we want to think about, right, their core body temperature is already elevated. So you're probably going to want to turn off your bed heater. You're going to be cautious with warm steam towels. You're going to be cautious with steam. You want to maybe keep the room a little bit more comfortable. You may be thinking about really lightweight, cool sheets, nothing like heavy flannel. You may have to change up your bedding when it comes to that. Electrical modalities, the use of like galvanic, high frequency, microcurrent, ultrasound, and laser are definitely a no-no. So anything that's going to be conducting a current through the body is definitely going to be something we want to avoid. Microdermabrasion is one of those points of professional exfoliation that tends to be controversial. There are some people who say absolutely not. And then there are some options that say yes, but with caution. So to err on the side of caution, we recommend that you may want to wait until after pregnancy just to kind of eliminate any potential risk. And risk, I mean aggressive microdermabrasion that could cause inflammation and make pigmentation worse. So again, it's one of those things that it's important to consider the effects when you're doing things that are resurfacing the skin. We don't want a pregnant woman to experience any type of additional discolorations on the face because we've actually caused more inflammation, and that can definitely leave some marks behind. So we have to be careful about, noticing and doing our skin analysis. Do I see inflammation, any redness, any sensitivity? I would definitely avoid that. Again, it's just one of those very gray areas. It's yes and no. You've got pregnant clients who have healthy skin. The barrier is healthy. Nothing's compromised. We're not seeing any redness or sensitivity. And a very low level, like a wet, dry microdermabrasion works wonders for their skin. Again, if you're unsure, client is not okay with it, or again, you're seeing a lot of signs that are like redness and inflammation, we would avoid it. Also, just follow the manufacturer's guidelines and make sure that it is actually okay to use their device with that client. But electrical modalities, again, galvanic, high frequency, doing microcurrent, those types of things are going to be definitely avoided. And always follow your doctor's directions and adhere to their guidance. And if in doubt, just maybe eliminate that step out of your service. So a great option when we think about how can I create a pregnancy skin treatment, obviously performing a thorough consultation is going to be super, super important. Understanding where they are in their pregnancy, seeing if they have any issues on their skin, what their main concerns are, anything that they've been told to avoid, anything that they don't feel comfortable with. Ensure their comfort. You want to check your treatment bed, the temperatures, the pillows. We mentioned again, not laying flat. Can you tilt your bed up or provide extra, pillows with that? You also want to think about maybe bolsters, if you have that option for them underneath the knees, lighter sheets, avoiding anything heavy. So double cleanse, and of course, skin analysis, really paying attention to those areas where like breakouts or pigmentation might be noticeable. Exfoliation, keep it light at first. Let's see how the client's skin responds. So like enzymes or a light physical scrub. Extractions really only if necessary. And what I mean by that is that because the skin is going to be a little bit more sensitized and highly vascular, you want to proceed with caution with this. So nothing aggressive and putting a lot of pressure on those and on that nose area with those really delicate capillaries. You may change up your massage to something like a pressure point or an effleurage, nothing too heavy-handed or too stimulating. And of course, layering up your serum and mask are amazing. So we definitely want to provide, whether it's hydration or brightening or oil absorption when it comes to a mask, is a great time to do that. And add-ons are also exceptional. Neck and shoulders, scalp, there are other areas that we can definitely spend some more time on if we notice our pregnant client's skin tends to be a little bit more sensitive or has a lot of flushing. And then of course, spritz tone, moisturize, eye treatment, and SPF is a must. It's also good to complete, right, with his product recommendations and educate them and let them know, like, this is what I've used. This is what, is in your products that you're taking home. These are some of the steps that you can do that are going to be effective and safe. And, some locations will actually even put on on their menu, they'll do something like a pregnancy treatment, or it's a mommy time treatment, or something that actually shows that pregnant client that I've actually created something specifically for you, and it helps them understand that and helps them feel a little bit more comfortable. So when we think about home care, just a few suggestions. Again, let's have like a gentle soap-free cleanser is a great one. Exfoliation, keep it simple. Enzymes, lactic acid, and moisturize and wear sunscreen daily, and keep that skin hydrated and keep that in your body hydrated as well. And, when in doubt, consult a physician. This is a relationship that you have with this client. So, questions, suggestions, feedback, really touching base with them. We want them to feel 100%, comfortable. There's enough stress in their life right now. There's enough challenges, as it is to be, being pregnant, or concerns and worries. We don't want skincare to be one of those. We want them to feel really comfortable with their skincare. So, we definitely, our clients right now are really relying on our licensing, our professionalism, our knowledge to really help get them through this time, because just because they're pregnant doesn't mean that they're not concerned with fine lines and aging or brightening of the skin. They want their skin to feel more, hydrated, or they feel like dull. We want to be able to still continue to address their skin conditions, during pregnancy and also afterwards. So hopefully today has been helpful for you guys to get some good insight to what's happening out there in the industry, questions that could come into your treatment room, ways to feel really, I think, empowered and educated around your client, and ways that you feel comfortable in doing these treatments as well. So I just want to thank you so much for sharing your day with me, taking an hour out of your day to spend some time with us here at the International Dermal Institute. And we absolutely appreciate everything you're doing out there as well. So definitely stay safe. And stay connected with us. If you'd like to do some more research on your own, or like, gosh, where are we getting all this great information from? These are some examples that are a great place for you to check in on updates as well. They're just, again, some examples that you can bring up. Those, we can be happy to share those a little bit later, even after the webinar, because it can get overwhelming when you go online of like what's really factual and what really doesn't have any type of maybe strong research behind it. So those are just some great resources for you guys to take a look at. I'm just, again, thank you so much. I'm going to hand it back over to Celeste. We'll do some more questions for those of you who are staying with us for the next few minutes. And I know Celeste has some great things to share about dermalinstitute.com.
All right. I know we're kind of winding down from this. If there are any questions that we didn't get to, I have written them down, and I will make sure that Beth and I get some answers for you, and we'll send them back within the next day or so. I know there were lots of questions about student notes and everything. We did record this. We will be sending you the recorded version so you can replay it 1,000 times over if you'd like. And this slide is perfect. ExploringDermalInstitute.com is actually where we're going to house this webinar, and it's now going to be called a Webisode. So thank you again, Beth. Beth also is a key player in the Living Skin podcast. I know somebody said it earlier. It's such a great way to hear from your own professional skin therapist network, from some great industry leaders. I know she has some things that she's coming out with over the next couple weeks that we will always post on dermalinstitute.com. We want you to follow us on our Instagram page, on our International Dermal Institute Facebook page. That's how you can stay up to date with us. We post frequently throughout the week. We love to put stories up. We'd love to hear from you guys on what you want to hear from us. So please make sure that you are following us. That's a big plus for us on our end. And then what we did release this last year was our membership program for the International Dermal Institute. This is the first time we've had a membership for us, and we're very excited to launch that you would get some free IDI classes, some free master classes, and also some really fun swag, which who doesn't love good swag? And what's really great is that we do have continued support throughout the year with this membership program as well. So please go back to dermalinstitute.com to learn more. And feel free to reach out to us anytime at idi.corporate@dermalogica.com, and we'll be available there anytime for you. And then look out from an email from myself. I will include Beth's email as well if you have any further questions related to this topic or anything International Dermal Institute, because that's what Beth and I do, is we just make sure that you guys are taken care of in that sense. So thank you guys so very, very much, and we really, really appreciate it.
Great. Thanks, Celeste. Again, thank you guys again for being here. Celeste would just stay on